Welcome to Vanderbilt Mohs. My name is Anna Clayton, and I am the Fellowship Director. We're very excited you're interested in our program and very proud of it, so I'm happy to share information about it with you. I'm the Fellowship Director, as I said, and have been so since January of 2013 when I took over from Dr. Thomas Stasko, who left us to be the chair of the Department of Dermatology at the University of Oklahoma in December of 2012. Before that, I was Assistant Fellowship Director from about 2008 until he left the fellowship in my care. I did my derm training in San Antonio with a combined military program from 1995 until 1998. Now, the Air Force is a bit different, so I had been a flight surgeon for 4 years prior to starting my residency. After completion of my residency, I practiced general dermatology in the Air Force at Eglin Air Force Base in Florida until I started my fellowship with Dr. Stasko here in Vanderbilt in July of 2001. From 2002 to 2004, I was one of 3 staff Mohs surgeons at the combined military dermatology residency training program in San Antonio, where I had been trained. I left the military in 2004 and became the first Mohs surgeon hired on staff at the derm residency program at the University of Texas, San Antonio. Before that, all their prior Mohs training had been provided by private practice Mohs surgeons in the area. I learned a lot there about setting up my own Mohs lab and working solo as an academic Mohs surgeon. I left there in 2007 to rejoin Vanderbilt as a third Mohs surgeon. At the time, my colleagues were Tom Stasko and Michel McDonald, who I'd trained with as a fellow. It was a lovely homecoming. Today, we are a group of 4. My colleagues are amazing surgeons, excellent physicians, and wonderful human beings. Michel is our direct boss, director of surgery, and the most active political advocate for our specialty and subspecialty in our group. Bill Stebbins is our director of cosmetic dermatology, and he's quite gifted at it. He's my assistant program director for the fellowship. Allison Hanlon is chief of dermatology at the VA. She holds a PhD and is extremely interested in bench and clinical research. We've all worked together for at least 5 years. Michel and I since 2007, which doesn't include my year of fellowship training with her as the second Mohs surgeon. Bill joined us in 2010. Allison about 5-6 years ago. There's a lot of continuity and mutual respect in this program, the respect being something we value extremely highly. The first fellow graduated from Vanderbilt in 1996, and we've had a fellow every year since then, except for 2013 to 2014, when we shifted from the ACMS to the ACGME accreditation. Today, our fellows learn surgery from 4 different points of view, 4 surgeons at different points in their careers, all very experienced. I often refer to the fellow as my fellow because ultimately I'm responsible, but in truth the fellow is our fellow. We all participate in the training of that fellow. In addition, we have excellent relationships with our surgical subspecialist colleagues outside our department with plastics, ENT plastics, oculoplastics, surgical oncology. The fellows have an opportunity to observe and participate hands-on in cases with many of them. They're very generous with their time and their experience. Graduates of our program have gone on to set up their own successful private practices, join growing specialty groups, and have been hired as staff at well-respected academic dermatology programs. They can do it all. I'm often asked what we look for in a fellow. Our goal is to train someone who will contribute to our specialty, someone we will be proud to say we have helped along the way. Of the applicants that come, all are already academically gifted, accomplished, and driven. But in particular, we look for a very healthy work ethic, dedication to our specialty, empathy, inquisitiveness, loyalty, and that special ability to play well with others in the sandbox of life. If that describes you, please apply.
I'm Bill Stebbins. Nice to meet you. I'm the Associate Program Director for the MSDO Fellowship, and I'm the Director of Cosmetic Dermatology here at Vanderbilt. I have been here for 10 years. I actually came here from Boston and have loved being in Nashville, and I love working with our crew here at Vandy, who you're meeting via video right now. So I do Mohs surgery 3 days a week, and I work with a fellow on Thursdays, and then on Fridays I have a full day cosmetic clinic, and the fellow's usually with me on Friday afternoon, but they're always welcome to join any other day of the week where they might finish Mohs, and we might be doing some cosmetics on some other days as well. I usually do a little bit every day. We do everything from Botox, fillers, we do pretty much all of them, to V-beam laser, Gelamax laser, we have fractional CO2, we have a Q-switched Nd:YAG, and by the time you arrive, who knows, we might even have more. We're in the process of actually looking into expanding our arsenal and updating some of it. We also have availability for you all to really go wherever you want to explore any other cosmetic interests that you have where we might not have the device or do the procedure. We work with plastic surgery, our head and neck colleagues, and with a bunch of the other dermatologists in town who have a ton of devices and do all sorts of procedures that complement what we do. So if it exists, and it exists in Nashville, we will find a way for you to get in to see it as much as you want. And we look forward to seeing you soon and working with you on all things Mohs and cosmetics. Thanks.
Hi there, my name is Michel McDonald, and I'm Director of Dermatologic Surgery here at Vanderbilt, coming to you from one of our cosmetic surgery rooms here. I've been here for over 25 years, and I'm very blessed to work with three amazing Mohs surgeons, Drs. Tina Clayton, Allison, Hanlon, and William Stebbins. My practice focuses on Mohs micrographic surgery in high-risk skin cancer patients, and the fellow usually works with me 1 day a week or 1 day every other week on my surgery days. And during that time, you're the only one working with me, so you get lots of surgical experience. My focus throughout my career has been on education of fellows and advocacy. I have an interest in organized medicine in order to preserve the specialty for future Mohs surgeons like yourselves. I serve on committees within the American College of Mohs Surgery and the American Academy of Dermatology in the advocacy space. And I hope to help Dr. Clayton develop future leaders in our specialty, and I'm so excited that you're interested in Vanderbilt.
Hi, my name is Allison Hanlon, and I'm one of the 4 Mohs surgeons here at Vanderbilt. Thank you for showing interest in our program. It's a great program where we have been able to train numerous people who've gone on and had great careers in Mohs micrographic surgery and procedural dermatology. Myself, along with my 3 colleagues, Dr. Bill Stebbins, Dr. Tina Clayton, and Dr. Michel McDonald, have really enjoyed the opportunity to train future leaders in dermatology. My role here at Vanderbilt is to treat high-risk skin cancer patients, including the solid organ transplant recipients. I greatly enjoy my clinic as well as my procedural days, which are 3 days a week here at Vanderbilt. 2 days a week, I am the service chief at the VA, where the fellow comes 1 day a week to participate in the care of veterans. It's a great opportunity for the fellow to function there and to be able to expand their knowledge. One of the great parts of training at Vanderbilt is our interaction with members of the Vanderbilt Ingram Cancer Center programs, such as the Melanoma Tumor Board, as well as the Head and Neck Tumor Board. Through that involvement with Head and Neck, we are involved in a clinical trial and can see other trials that are in our future. We're really happy that you've taken the time to learn about our program. I look forward to you meeting you, and I hope that you will consider Vanderbilt.
Hi, my name is Grilletta. I'm the Mohs Fellow here at Vanderbilt for the 2020-2021 year. Just to tell you a little bit about the experience here as the Fellow, first of all, it's a fantastic year. And you really do get a little bit of everything that Vanderbilt has to offer. So the typical schedule for the Fellow is that in any given week, you spend 1 day at the VA working more as a senior, educating the second year residents, doing excisions. And then the rest of the time, the other 4 days, you'll be at the Vanderbilt main clinic and splitting your time amongst all the faculty members. So Dr. Clayton, you'll work with her at least 2 days a week, sometimes 3 days a week, and then Dr. Stebbins specifically 1 day a week. The rest of the attendings, Dr. Hanlon and Dr. McDonald, you'll also rotate multiple days per month with each of them. And then in addition, our other faculty members from other specialties, such as with plastic surgery and ENT, will also be available and in clinic, and you can hang out with them and get a little bit of a broader experience that way. In addition, if you have any interest in ongoing teaching, not only, like I said, you get to spend time with the residents at the VA, but you also host a surgery journal club every 2 months, and that is really geared towards those residents. And so there are assigned articles that you get to choose, and all the attendings also attend, as well as some community surgeons who like to participate. And it's really a great experience. Hopefully, post-pandemic, we'll be going back to in-person with a full dinner. But regardless, you really do get a well-rounded experience here for faculty members, just in the dermatology world, in addition, like I said, to the other medical specialties and multiple sites to work at. So it's a fantastic place. Been very good to me so far.
Hi, my name is Stacy McMurray. I'm currently a Mohs surgeon at the University of Pennsylvania. I completed my fellowship at Vanderbilt in June of 2020. The fellowship program at Vanderbilt is exceptional. You have the opportunity to work with 4 different Mohs surgeons, each with unique practice styles. There's a high case volume and a wide range of complexity. Your surgical autonomy will increase with your skill level, and you will easily meet, if not double or triple, your case requirement for the year. You also have the chance to work with our colleagues in ENT, oculoplastics, and plastic surgery on a regular basis. I often followed my complex cases to the operating room for further resection and reconstruction if required. This taught me the value of working in a multidisciplinary team, particularly for high-risk cancers. Now, the strong clinical acumen is really complemented by participation in resident education. I worked with our excellent residents on a weekly basis and contributed to their surgical training. The Vanderbilt program stands out because it offers a broad range of educational experiences that can be tailored to your interests. The surgeons there really served as mentors to me, guiding and encouraging me to develop my own clinical and research interests. They're committed to helping their fellows achieve their career goals, whether in private practice or in academics. I'm really grateful to have had the opportunity to learn in such a supportive and encouraging environment. My training there really equipped me with a solid foundation of knowledge and skills needed to start my career in academic medicine.
Hey there, my name is Charlie Dara. I'm a Mohs surgeon in Greenville, South Carolina at a practice called Carolina Dermatology of Greenville. And I'm kind of here to tell you all the great things about Vanderbilt Mohs Surgery Fellowship. I personally did my residency and my fellowship at Vanderbilt, so I was around all the great Mohs attendings for 4 years of my life, and I really have nothing bad to say about them. Anybody who ever asked me about how my training went or if I felt well prepared, I always only have great things to say. I think there's a few things that me personally, when you think about what set Vanderbilt apart, I think there's a few things that I really always circle back to. Most importantly, I think it's great that you have several Mohs surgeons to train under, because then you get to work with all of them very frequently, and you get to kind of choose and pick certain aspects of what they do that you really like, and you kind of get to mold your own way of doing Mohs surgery. There's a lot of fellowships out there that it's kind of a one-person show, which is totally fine, that they get great training, but you know when you're done with that fellowship, you're going to practice pretty much exactly like the person you trained with. Whereas at Vanderbilt, it's a little bit more, you get a lot of different opinions, and all 4 of them have their own personalities, or when I was there, 4 of them. Then you get to kind of mold the exact kind of Mohs surgeon you want to be. Also, you know, me spending 4 years there, I literally have nothing bad to say about the people that they are. I think it's important when you're doing fellowship to be held to certain expectations, because that's how you learn. You know that the people that are training you have expectations for how you're going to do your job, and that makes you the best Mohs surgeon you can be. But at the same time, they're all super kind and friendly and really make your daily work environment almost feel like you're not working while you're still learning a great deal. And lastly, I really feel that you come out very well prepared. I've been doing full-time Mohs for 3 years basically since I graduated fellowship, and done thousands of cases, and I've never felt unprepared to tackle any skin cancer that walks through the door or any reconstruction, and I owe all of that to my training at Vanderbilt.